Viper360 allows users to see the most up-to-date information for a patient in real time and at the point of care on desktop or mobile devices. It is wholly configurable and is designed to fit to an organization's requirements, allowing them to improve their processes and practices without changing them. Viper360 makes use of existing LDAP login systems to ensure that users do not need to remember additional login information. The Viper360 dashboard contains the application specific to a user and is also used for messages and alerts, both hospital-wide and personal. Personal alerts can also be received by email or SMS, warning a user that there has been activity on one of their patient's records or that a task has been assigned to them. Launching the Patient View application presents the user with the search screen, and from here they can find their patients. On the left-hand side are the user-specific lists of patients. For users in an inpatient setting, this could be a list of wards that they have permission to view. Selecting one of the wards will provide a list of all patients currently in that location, along with their consultants or any other details, patient status at a glance icons, or alerts requested by the trust. In other settings, the left-hand list could be an outpatient clinic view, containing a list of clinics and today's schedule. With integration to a check-in kiosk system, this could also show the current attendance status of each patient. For GPs, the left-hand list could be an alphabetical index filtering patients by surname, and for community users, it could be that day's caseload. Any group of patients, such as those with a specific condition, can be presented as a list in this way, specific to the user's role. There's also a My List section allowing users to view their recent patient history and also create and name virtual wards, which can then be populated and shared with colleagues. Details for any patient on the Trust database can also be found by searching on NHS number or local identifier, demographic details, or any field the Trust requests. Whichever method is used to find a patient, selecting them opens the patient detail screens where everything is within the context of that one patient. All patient detail screens are headed with the patient banner, which contains all obligatory NHS data items as well as any others requested by the Trust. Alerts for the patient are flagged and made available through links or icons as required. Beneath the banner are a series of tabs containing the care information from the various data sources, all of which are extracted from the supplying systems in real time, meaning that not only is the data always up to date, but also that Viper360 does not need to become another repository of data within the organisation, with the development and maintenance overheads that would entail. The tabs, the data sources, and the format of the data on the screen are all configurable based on the Trust requirements and will be presented appropriately for users in different roles, allowing them to see the most important data instantly at the point of care. The first tab presented to the user is the Patient View Summary, which in an inpatient setting could contain the patient history including outpatient, inpatient and A&E activity. Data from neighbouring or merged trusts can be displayed in one place to present a more complete history. The history can be defaulted to only show the most recent activity, and can also be expanded to pull back historic data. Outpatient activity can also be selected to show future clinic appointments, and clicking on an outpatient entry can be configured to take the user to the Documents tab, where they will be presented with the corresponding outpatient letters. Documents from any source within the Trust can be made available to users, whether the document is on a local shared drive or an external supplier system. In the same way, completed discharge summaries could be linked to previous inpatient spells, and selecting a current inpatient spell could open a new or existing discharge summary for editing. Other data that might be required on the Patient View Summary screen includes a brief description of the laboratory orders and results, where selecting a pathology result opens the corresponding lab system embedded in another tab. The user is automatically logged into the system using their own login details and is taken directly to the patient in context and to the selected result. Most systems can be embedded this way, so radiology results could be linked to the corresponding X-rays, either using existing software or via Viper360's own image viewer. All the functionality of these systems will be available to the user, allowing them to place orders or add medications. Navigation to a different patient is, however, disabled, ensuring patient and clinical safety. All tabs and data feeds can be limited by user role, data content, and patient consent. Viper360 has its own consent model, which can be configured for face-to-face interactions with patients or to gain future consent to view. The consent model is used for access to GP records through the Medical Interoperability Gateway, or MIG, whilst the patient is present. The options available can also be chosen by the Trust, including options to access records without explicit consent in an emergency situation. Overriding consent in this way always requires an explanation, which is logged for audit purposes. Any interaction, including overriding, can be set to automatically alert an administrator if required. Access to the MIG is via the fully accredited Viper360 MIG plugin. GP records could also be retrieved directly from GP systems or via the summary care record through a connection to Spine 2. The primary care data presented to the user will be from the best available source for the selected patient. Viper360 can also be used to input and store data against a patient. Data entered into forms can be pushed back to update external systems. Current electronic or clerical processes used by a trust can be simply redeveloped within Viper360, enabling care plans and other generated documents to be linked automatically and directly to a patient's record. Documents created in this way will immediately be available to appropriate users within the Documents tab. Depending on user permissions, documents will either be available to view or edit. Entered data combined with alerting and data queries can form the basis of a cross-organisation workflow, ensuring that everyone involved in a patient's care, whether they use Viper360 or not, is automatically alerted to vital details such as admissions, discharges, A&E visits and changes of condition. All interactions between users and patients in Viper360 are securely logged and available to admins or super users to view and create reports. Admins can also use this application to create alerts and messages targeted to one group or across an entire organisation. Viper360 delivers a true integrated digital care record across primary, secondary, community, mental health and social care. It provides an ROI value for money model designed to meet the NHS England criteria for funding and utilises open technology to deliver major interoperability benefits. It is a leading solution that will meet integrated digital care fund expectations and funding requirements, providing a faster, cost-effective and more flexible delivery than traditional portal solutions.